Welcome back to Living Well After 50. Did you know that 1 in 3 people will develop cancer at some point in their lifetime? While that statistic might sound alarming, the importance of early detection just can't be overstated. When it's caught in the earliest stages, a lot of types of cancer have survival rates that go over 90%. But by stage 4, that number drops to less than 20%. So today we're going to do a deep dive into subtle signs of cancer that are easily missed. All those warning signs that anyone over 50 should know. It's all about being informed and staying proactive.
Yeah, it's interesting how we often think of cancer as having these really dramatic symptoms, these debilitating symptoms. But in reality, many early warning signs are actually pretty subtle. They're really easy to brush off as just a normal part of getting older. So that's why it's so important to really pay attention to your body and to notice any kind of persistent changes, especially when we reach this stage of life.
Yeah, it's like our bodies are trying to whisper to us, and we need to learn how to listen. So, okay.
Yeah.
Let's start with a really common one. Persistent heartburn. I mean, we've all had heartburn maybe after like a spicy meal.
Yeah.
But what if it just keeps nagging at you for weeks or even months? Even when you're taking antacids. Is that just a sign of getting older, or could it be something more?
That's a great question. And that's really when you need to start paying closer attention. Because occasional heartburn is totally normal, but when it's chronic, it could be pointing to something more serious, something like esophageal cancer. And, you have to think about it. The esophagus is the tube that carries food from your mouth down to your stomach. And so all that constant acid reflux can actually damage the lining of your esophagus. And that damage can increase the risk of developing cancer.
So it's not just about the discomfort. It's about the potential long-term damage. What else should people be looking for? Besides that burning sensation.
Well, difficulty swallowing is a big one. A feeling like the food is getting stuck. Or even like unexpected weight loss. If you're experiencing any of those things, it's definitely time to go see a doctor.
It sounds like we shouldn't just try to tough it out with heartburn. If it's persistent, getting it checked out could really make a big difference. All right, so let's move on to another subtle sign. Unexplained night sweats. I know hot flashes can be pretty intense for women as they get older. But how do you know if it's something more than just that?
That's a really great point, because hormones definitely play a role. But drenching night sweats, the kind that soak right through your sheets, that's a whole different story. That could actually be a sign of lymphoma, which is a type of blood cancer that can affect your body's temperature control.
So it's about the intensity and the frequency, not just, feeling a little bit warm. Are there any other symptoms that people should be looking for, along with those lymphoma-related night sweats?
Yes, absolutely. Often, lymphoma is accompanied by what doctors call B symptoms. These are kind of like the immune system's SOS signals, things like fever, unexplained weight loss, and just feeling really fatigued. And it's basically your body trying to fight off those cancerous cells.
Soaking the sheets, fever, fatigue. Yeah, that's definitely a sign to pay attention. All right, let's talk about jaundice. I know it causes yellowing of the skin and eyes,
Yeah.
but how does that relate to cancer?
Well, jaundice can actually be an early warning sign of either pancreatic cancer or liver cancer. And it's caused by a buildup of something called bilirubin in the blood, which is a yellow pigment. So when your liver is working properly, it processes the bilirubin. But when these types of cancers are present, they disrupt the liver's function. So the bilirubin starts to build up, and that leads to that yellowish discoloration. You can kind of think of it like a traffic jam in your liver.
Interesting analogy.
Yeah.
So while jaundice can also be a sign of other things that are less serious, like gallstones, it always warrants immediate medical attention, right?
Absolutely. If you notice any kind of yellowing of the skin or eyes, don't wait. Just get yourself to a healthcare professional as soon as possible. Early detection is really critical with these types of cancers.
Good advice. Now let's talk about bone pain. We all get aches and pains as we get older, but how can we differentiate those normal aches and pains from something that's more concerning?
That's right. Some aches and pains are just a normal part of life as we age, but bone pain that's really persistent, really deep, and especially if it gets worse at night, that's kind of a red flag. That could be a sign of actual bone cancer, or it could be cancer that started somewhere else in the body and has now spread to the bones, which we call metastasis.
So it's not your average ache. This is a pain that's really intense and it doesn't let up.
Mm.
And it doesn't respond to rest or, over-the-counter painkillers. Is there anything else we should look out for?
Yeah, definitely keep an eye out for any swelling around that painful area, or even fractures that happen without a significant injury. If you experience something like that, that's a strong sign that something more serious might be going on.
So if we're having bone pain that fits that description, it's time to go see a doctor. Don't just try to push through it.
Exactly. Early diagnosis and treatment are really essential, especially when we're talking about bone cancer. The sooner you address it, the better the outcome is likely to be.
Okay, so this next one might surprise some people. Body rashes. Could a rash really be a sign of cancer?
Well, you might be surprised to hear this, but yes, it actually could. Tiny red or purple spots on the skin, which are called petechia. They can sometimes be a sign of leukemia, which is a type of blood cancer.
Well, that's not something you hear every day. Can you explain a little bit about what causes those petechiae?
Sure, so it really comes down to platelet levels. So platelets are the cells in our blood that are responsible for clotting. And leukemia often causes a drop in the number of platelets, which means that the blood vessels can start to leak under the skin. And that creates those tiny red or purple dots. It's kind of like your body's tiny capillaries are springing little leaks.
So it's like a domino effect. The leukemia disrupts the platelet levels, and then that leads to these telltale spots. What other signs might indicate leukemia?
Besides those petechia, look out for things like frequent infections, bruising really easily, nosebleeds, or even bleeding gums. All of those can be signs of low platelet counts.
So the takeaway here is don't dismiss any unexplained rashes, especially if they're coming with these other symptoms. It's definitely worth getting checked out. Now, let's talk about another sign that can be a little bit vague. Persistent fever. I mean, we all get fevers from time to time,
Yeah.
but when should we be concerned?
That's a great question. Here's the thing. If you have a fever that lasts for more than 2 weeks, without a clear cause like an infection, that could be a red flag. It could be a sign of something more serious, including leukemia or lymphoma.
So it's not just about having a fever, it's about the duration and the lack of an obvious explanation. What makes these cancer-related fevers different?
Well, they often have this cyclical pattern where
Yep.
they come and go, almost predictably. And they also tend to be resistant to antibiotics because they're not actually caused by an infection, but by the body's immune response to the cancer cells themselves. It's like your immune system is constantly battling, and that's causing these temperature spikes.
So if you have a fever that's lingering and it's not responding to, the usual remedies,
Hmm.
that's definitely a sign to get a medical evaluation. Now, this next one is pretty interesting. Fingernail changes. Could our nails really offer clues about cancer?
Believe it or not, yes, if you have a dark vertical streak under your nail, that could be a sign of something called subungual melanoma, which is a rare but serious type of skin cancer.
I never would have thought to look at my nails for cancer signs. What should we be looking for specifically?
The thing to look for is a dark streak that extends beyond the nail bed, and that's called Hutchinson's sign. You should also be on the lookout for any sudden changes in your nail's pigmentation or shape, especially if it just involves one nail. It's kind of like your nail's trying to send you a message.
So any unusual changes in our nails warrant a trip to the dermatologist. Okay, let's wrap up this part of our deep dive with another seemingly unrelated symptom, eye pain. Could that be connected to cancer?
Yes, it could if you have persistent eye pain, especially if it's accompanied by dark spots on the iris. That could be a sign of ocular melanoma, which is a type of eye cancer. It's more common in people with fair skin and light eyes, and people who have a history of sun exposure. But anybody experiencing those symptoms should really see an ophthalmologist.
So we're not just talking about a little eye strain here. This is persistent pain, maybe with visual changes, like those dark spots you mentioned, or blurred vision. What else might point to ocular melanoma?
Well, one thing to watch for is a change in your peripheral vision or a growing dark spot on the iris. Those can be signs that the tumor is developing.
This has been incredibly insightful. We've uncovered so many subtle signs of cancer that are really easy to overlook, especially as we get older. And I'm sure our listeners are feeling a lot more empowered now to really tune into their bodies. We'll be back with more in part 2, so stay tuned.
Welcome back to Living Well After 50. We're going to keep digging into those subtle cancer warning signs, the ones that often fly under the radar.
I think a lot of people assume that cancer always announces itself, like with these big dramatic symptoms. But as we've seen, that's not always the case.
Yeah, absolutely. It's often about noticing the whispers, those subtle little changes that our bodies are trying to tell us about, especially as we age.
So true. All right, what's next on our list of these subtle signs? What else should we be paying attention to?
Well, let's talk about changes in bowel habits. It might not be the most glamorous topic, but it's a really vital part of our overall health picture.
Okay, bowel movements might not be dinner table conversation, but they are a window into what's going on inside. So what kind of changes should we be concerned about?
Well, any kind of significant and persistent change in your bowel habits could be a sign of a problem, potentially even colon cancer. Because if you think about it, colon cancer affects the large intestine, which is where waste is processed. So changes in your bowel movements can be an early indicator of a problem there.
So we're talking about more than just like an occasional upset stomach or something. What specifically should we be watching out for?
Well, blood in the stool is a big one. Also, persistent diarrhea or constipation, a feeling like you haven't completely emptied your bowels, or even a change in the shape of your stool, like if it becomes very narrow or flat. Those are all signs to pay attention to because those kinds of changes could actually be due to a tumor that's obstructing the colon.
Yeah, those do sound like pretty clear signs that something's not right. But I mean, wouldn't some of those things just happen from time to time anyway, just because of like diet or stress or something?
Yeah, you're right. Occasional changes are perfectly normal, but the key here is persistence. So if you notice these changes happening regularly and for a prolonged period, definitely don't hesitate to talk to your doctor about it.
So it's about recognizing those patterns
Yeah.
and not just brushing them off as, just a fluke. And of course, regular screenings are important too,
Yeah.
like colonoscopies. Those are really crucial for early detection.
Absolutely. Colonoscopies can detect precancerous polyps, and they can find early stage colon cancer, which can significantly increase the chances of successful treatment.
Yeah, great reminder. Now let's move on to another area that might raise some eyebrows. Changes in urination. How could that be linked to cancer?
Well, changes in urination, especially in men, can be a sign of prostate cancer because the prostate gland actually surrounds the urethra, which is the tube that carries urine out of the body. And so as the prostate grows, which is common in prostate cancer, it can press on the urethra, and that can cause all sorts of urinary
Yeah,
problems.
that makes sense. So what kind of changes should men be aware of? What should prompt them to go see a doctor?
Well, one thing is difficulty starting or stopping urination. Also, a weak or interrupted stream. Frequent urination, especially at night, or pain or burning during urination.
Yeah, those symptoms could really impact someone's quality of life. It sounds like they shouldn't hesitate to get checked out.
Exactly. And while these symptoms could be due to other conditions, like an enlarged prostate, ruling out prostate cancer is really crucial, especially for men over 50, because early detection makes a huge difference in the treatment options and the outcomes.
Okay, let's shift gears a little bit and talk about unexplained weight loss. We often hear that sudden weight loss can be a warning sign. But how much weight loss should actually raise a red flag?
That's a good question. If you lose 5% or more of your body weight within a 6 to 12-month period, without actually trying to lose weight, that's definitely a reason to go see your doctor.
So if the pounds are just dropping off,
Yeah.
and you haven't made any changes to your diet or your exercise routine, it's time to investigate further. Why is unexplained weight loss such a concern, especially in the context of cancer?
Well, it's often one of the first noticeable signs of several different types of cancer. Cancers of the stomach, pancreas, esophagus, and lung, they can all affect your metabolism and your appetite, which can lead to unintentional weight loss. Plus, the tumor itself can consume a lot of energy, and that can also contribute to weight loss.
It's amazing how our bodies can signal that something's wrong, even without any obvious pain or discomfort.
It really is. And that's why it's so important to be aware of these subtle changes and to seek medical advice if anything seems off. It's not about being paranoid, it's about being proactive and taking charge of your health.
Now let's move on to a symptom that people might not immediately associate with cancer. Sores that don't heal. We often think of skin cancer as like a mole that changes or something. But could a sore be a sign as well?
Yes, absolutely. Sores that don't heal within a reasonable time frame or that keep coming back can definitely be a warning sign of skin cancer.
It's interesting. I guess we tend to think, oh, it's just a cut or something. It'll heal eventually. But if it lingers, that could be a red flag. What should we be looking for specifically?
Well, any sore scab or growth on your skin that doesn't heal within a few weeks warrants a visit to the dermatologist.
Are there particular types of skin cancer that might show up as a non-healing sore?
Yeah, basal cell carcinoma and squamous cell carcinoma. Those are the two most common types of skin cancer. And they often appear as sores or growths that just don't heal the way they should.
So even if it doesn't look like a typical mole, it's still worth getting checked out. Okay, now let's talk about another symptom that might seem a little bit broad. Unusual bleeding or discharge. Can you elaborate on that a bit?
Sure, this covers a wide range of possibilities, but basically any kind of unexplained bleeding or discharge from any part of your body should be investigated. It's just one of those things that shouldn't be ignored.
Can you give us some specific examples of what you mean by unusual bleeding?
Certainly. So, for example, coughing up blood could be a sign of lung cancer. Vaginal bleeding after menopause could indicate endometrial cancer. Blood in the urine could signal bladder or kidney cancer.
Wow, that's a lot to consider. I think a lot of people might dismiss, a little bit of bleeding or discharge
Mm.
as no big deal. But it sounds like it's always better to err on the side of caution.
Yeah, you're absolutely right. It's much better to get it checked out and just have that peace of mind than to ignore it and potentially miss an early warning sign. It's all about being proactive and advocating for your own health.
This has been another really informative segment. We've covered so much ground, and I'm sure our listeners are feeling a lot more equipped now to spot these subtle signs. We'll be back with even more in part 3, so don't go anywhere. Welcome back to Living Well After 50. We're wrapping up our deep dive into these subtle cancer warning signs that are often easy to miss.
Yeah, it's really amazing how much we've uncovered already about these signs that we often just don't even think about.
It really is eye-opening. And while we've covered a lot, there's still a few more signs we need to touch on. So what's next on the list?
Well, let's talk about thickening or a lump in the breast or elsewhere. This is something that everyone should be aware of, regardless of gender.
That's right. We often hear about breast cancer awareness, and it's often geared towards women. But men can develop breast cancer too. And you're right, it's not just limited to the breasts.
Exactly. Any unusual lump or thickening anywhere in the body should be checked out. So we're talking about anything that feels different or new, or if you have an existing mole or spot that changes in size, shape, or color.
So it's all about being familiar with our bodies and noticing any changes that seem out of the ordinary. So what's the best course of action if someone does find a lump or thickening?
Well, the first thing is don't panic, but don't ignore it either. The best thing to do is schedule an appointment with your doctor. They can examine the area and determine if any further tests are needed, like a biopsy.
It's all about early detection. Catching these things early can make a huge difference in the treatment options and, of course, the outcomes. Okay, let's move on to another area that people might not think about as being related to cancer. Indigestion or trouble swallowing. How could those be warning signs?
Well, if you think about it, persistent indigestion or difficulty swallowing could actually be a sign of a few different types of cancer, including esophageal stomach or throat cancer, because these cancers can actually affect the digestive tract, which can make it harder for food to pass through smoothly.
So if you have that heartburn that just won't quit, or you feel like food is getting stuck, it's not something to just ignore as we get older.
Exactly. While occasional indigestion after a big meal is totally normal, if it's persistent or it comes with other symptoms like unexplained weight loss or vomiting, it's really important to see your doctor.
It's about recognizing those patterns and knowing when it's more than just like a passing discomfort. What about hoarseness or a cough that just won't go away? Could those also be red flags?
Absolutely. A cough that persists for more than a few weeks, especially if it's accompanied by hoarseness or coughing up blood, could be a sign of lung cancer or even head and neck cancer. You see, these cancers can irritate the vocal cords or airways, and that can lead to those persistent coughs.
Yeah, I think it's easy to just write off a cough, like, oh, it's just a cold or allergies,
Yeah.
especially, during certain times of year. But it sounds like it's worth getting it checked out if it's lingering, and it doesn't seem to have a clear cause.
You're absolutely right. It's always better to err on the side of caution and rule out anything serious. Early detection is key. And that starts with paying attention to our bodies and seeking medical advice when something just doesn't feel quite right.
Well, this deep dive has been incredibly informative. We've covered so many subtle warning signs of cancer, and I'm sure our listeners are feeling much more empowered now to really be proactive about their health. Before we wrap up, are there any key takeaways that you want our listeners to remember?
Well, I think the most important thing is to trust your instincts. If something feels off or different in your body, don't ignore it. Talk to your doctor. Don't be afraid to ask questions and really advocate for your own health. You know your body better than anyone else.
Yeah, and early detection is so important. It really can make all the difference.
Absolutely. Regular screenings and checkups are essential, especially as we age, because early detection often means more treatment options and a better chance of successful outcomes.
Well, this has been a fantastic deep dive into those subtle warning signs of cancer. We hope this information empowers you to take charge of your health and well-being. Remember, knowledge is power, and early detection saves lives. Take care, and we'll see you next time on Living Well After 50.